Have you ever noticed an unexpected lump or growth on your body, or perhaps heard a doctor mention an abnormal finding on a scan? It is completely normal to feel a surge of concern when you encounter the word tumor, and understanding what it truly means can help ease your worries. Simply put, a tumor is an abnormal mass of tissue that forms when cells grow and divide more than they should, or do not die when they are supposed to. Think of it as a gathering of extra cells in one area of your body. These growths can occur in almost any part of the body, from your skin to your internal organs, and understanding them is a crucial first step in medical care. The core mechanism behind tumor formation lies in the incredible process of cell growth and division that usually keeps our bodies running smoothly. Every day, old cells die and new ones are created in a perfectly balanced cycle. However, sometimes genetic changes or mutations can disrupt this balance, causing cells to multiply uncontrollably or to fail to undergo programmed cell death. When these unregulated cells accumulate, they form a mass that we call a tumor, which can be either benign or malignant depending on its behavior. Distinguishing between benign and malignant tumors is extremely important. A benign tumor is a non-cancerous growth. It usually grows slowly, does not spread to other parts of the body, and typically does not return after being removed. Examples include uterine fibroids or common moles. On the other hand, a malignant tumor is cancerous. These cells can grow rapidly, invade nearby tissues, and even spread to distant parts of the body through a process called metastasis, forming new tumors. This is why a precise diagnosis is so critical. If you notice any new or unusual lump, swelling, or changes in your body, the best first step is always to consult with your doctor. They will likely perform a physical examination and possibly order imaging tests such as an X-ray, magnetic resonance imaging scan, or computed tomography scan. The definitive way to determine the nature of a tumor, whether benign or malignant, is often through a biopsy, where a small tissue sample is taken and examined under a microscope by a pathologist. It is helpful to know that doctors sometimes use the term neoplasm as a more general medical term for any abnormal growth of cells, whether it is benign or malignant. This highlights the scientific understanding that any uncharacteristic cellular proliferation warrants investigation. While the word tumor often evokes fear, it is important to remember that many tumors are not cancerous, and even malignant tumors have a wide range of treatment options available, especially with early detection. Ultimately, recognizing that a tumor is simply a collection of cells growing in an unusual way empowers you to take proactive steps for your health. Whether it turns out to be harmless or requires treatment, understanding this basic concept means you are better equipped to discuss your options with your healthcare team, reducing anxiety and paving the way for the best possible outcome. Stay informed and engaged in your health journey, always.